The short-term impact of passive smoking on children is well known, but new research reveals that children can suffer irreversible damage to their cardiovascular health 20 years after being exposed to passive smoke. Medical reporter Sophie Scott explains.
Passive smoking increases the incidence of asthma and respiratory illnesses in children, amongst other health problems. Now Australian researchers have found it could do long-term damage as well.
What we've shown in this study is that it seems to be having an irreversible effect on the arteries of children that we can actually see when these children go on to be adults.
Scientists from Tasmania's Menzies Research Institute reviewed more than 2,000 subjects followed since childhood. They were re-examined in their 30s and 40s. Ultrasounds on the major blood vessels in the upper arm found reduced blood flow in those who'd been exposed to smoking as children.
The chemicals in cigarette smoke interact with the vessels, the lining of the blood vessels, and that seems to be causing an inability of them to expand and contract properly.
Less elastic arteries are an early indicator of poor cardiovascular health.
It does look like passive smoking as a child is now a risk factor in adult for coronary artery disease or cardiovascular disease. So that's a major change in our thinking.
The effect showed up whether or not the children went on to become smokers themselves. In Australia, as many as 45% of children live in a house where one or more parents smoke. But there have been moves to protect children. In most states and territories, there are laws making it illegal to smoke in a car with a child under 18.
Parents are a great role model for their children, and we know that if parents smoke, children are twice as likely to take up smoking.
The next stage of the Menzies research will examine how passive smoking might affect other aspects of heart health. Sophie Scott, ABC News.